When we started having resident learners a little over 2.5 years ago, myself and others on faculty realized that we needed a space to do simulation teaching. We have a very high acuity hospital at St. Joseph's, and part of training residents and medical students to take care of patients in the best way possible involves teaching them with simulation in advance so that they can learn high-risk procedures and how to take care of critically ill patients in a safe environment. Currently, we're sitting in the simulation lab and educational space for graduate medical education here at St. Joseph's. We're separated just by a parking lot from the main hospital, and this is the area where we do in-person resident education and simulation teaching. We're very fortunate. We have 2 full setup simulation rooms with cameras and two-way mirrors and mannequins, and we also have a large classroom we can use for teaching and a breakout room, as well as some administrative offices. And so this is where we primarily run simulation teaching as part of our didactics for family medicine, emergency medicine, internal medicine, and other learners that come through St. Joseph's.
All right, ready to get started?
We try to make the simulations here as high fidelity as possible. As I mentioned, we're very fortunate to have equipment that is really state-of-the-art, the best simulation equipment that's available. We can simulate patient encounters with mannequins that talk, that breathe, that have vital signs that can be measured, have pulses that can be felt. And this is very important when simulating a critically ill patients, that we make the fidelity as high as possible and realistic as possible in order to really put the learner in that environment.
Hello, sir. Hi, I am Dr. Sarti. I hear that you're having chest pain.
Yes, I am. My chest is hurting.
When did it start?
Oh, probably about 2 hours ago.
Additionally, there's voice that can be spoken through the speakers on the ceiling from the control room. The control of the actual mannequin, which is done through a computer, is performed inside of the control room, and the vital signs are manipulated from the control room as well and can be displayed on a variety of different monitors in the actual simulation room. So the patient care monitors are coordinated from the control room as well. Additionally, the control room has the functionality to send video and audio to a classroom that we have in our learning facility, or the debrief room. Simulation and having a high-fidelity simulation environment is very important to resident education. And in order to become well-trained in taking care of critically ill patients, I think high-fidelity simulation is an important part of any training program. I think both for patient safety as well as for learner progression and learner safety, I think that it's important for residents to learn in a safe environment where they can get feedback and work on improving their skills in a laboratory-type environment. So I think we offer that here at St. Joseph's. We have a state-of-the-art facility with best-in-class equipment and best-in-class physical space and best-in-class teachers in order to really make the resident education as good as it can be here.